Hi everybody, Bill here, and I'm still here. I'm back home. I got home yesterday. What's today? It's Sunday today. Sunday the 20, no, Sunday the 30th. So yeah, went in for surgery on the 25th, if you remember, and that took place at about 12 o'clock, and it was tough. Okay. Normally, I know I try and make light of everything, and I will try and stay positive, but yeah, it was tough. Now, I was 6.5 hours in surgery. It's a long operation, and my surgeon, his name is Mr. Danko Kostadinov. He's a lovely chap, but he's got big hands, and I've got a narrow pelvis. And he told me that it was a very tricky operation for him to get his hands into my pelvis to rummage around, because it was all very tight, not much room in there. So no wonder I'm feeling rather sore. He took my appendix out for good measure. You don't need that. And we don't want another operation that was unnecessary in a few years' time. And he also found what he looks like an ulcer too, somewhere around there, which he took out as well. So everything bad's been taken away, and that goes off to pathology, and they're going to look at that. And I'll go and see the surgeon's team in 3 weeks' time to find out the results of all that. But hopefully they've got out the bad stuff. So he's reattached what's left of my large bowel to what's left of my rectum, and he's managed to save 8 centimetres. That's all I've got for my anus. 8 centimetres of rectum. Still got full sphincter power, and but not much in the way of rectum. But of course, that tube's been reconnected. Amazing that what they can do. And when it heals up, then I can have the reversal, because do you remember, right hand side was the ileostomy, left hand side is the colostomy, and I woke up with the bag on the right hand side. I know it caused a bit of confusion for people because the camera phone flips everything back to front, but the bag was on the right, which means it will be reversed in the surgeon said 3 months' time. I'm sure it'll be longer than that, and I know there's a long waiting list because of it's a low priority, because once they've saved your life, it's low priority stuff. But at some point it will be reversed, and then I've got to see what my continence is like. I'm going to cross that bridge when I come to it. But if it doesn't work, then it can always then become another operation for a colostomy for life, which may not be a bad option, frankly. Anyway, pain, yes, it was painful. And when I came round, I did that last sort of update for you. I was still under the morphine and feeling woozy, and obviously it was all fine. But yeah, it was a very uncomfortable night, first night, and the first day was quite difficult. But I was up and about the next day, walking up and down the corridor of the hospital, going to, get as much sort of movement as I can, because they want you to do that. It's good for your recovery. I've got surgical stockings on all the time. These go up to my knee, and they compress your calves to try and reduce the risk of you getting blood clots, because you're high risk after surgery, especially if you're sitting around and not moving. That's 28 days without removing the stockings, apart from washing occasionally, whenever you can really. I've got a couple of spare pairs as well in case they get damp. I've got Clexane injections I have to administer myself into my stomach for 28 days too, every day. They are blood thinners, and they will again help me to not get blood clots. What else happens? Oh, there's so much to say. I'll try and limit it because I don't want to bore you all. And if you've got any direct questions, please ask, because I'll try and answer them. But well, one of the side effects with me was my gentleman's jewels, which suffered quite badly. Not the first day, but when I woke up, you see, I had a catheter. Now, this will make you wince, chaps, but I'm glad I was under general when they did it, but I had a tube up my penis through to my bladder, so I didn't have to worry about having a wee. And that was overnight, and for much of the first day until the surgeon saw me, and I didn't have to worry about it. But I I felt I wanted to get rid of this, so he agreed that they would take the catheter out, and I was unable to have normal wheeze while I was in the hospital. Yeah, I think I had a bad reaction to that catheter because honestly, Billy Smart could have been on the phone to me because I could have joined the circus. There is an elephant somewhere in Africa wandering around with a very, very small trunk, I think, because I was it was just unbelievable what happened there. It took a day or two for this thing to die down in size back to reasonable proportions. But yeah, be prepared for that, chaps. Not pleasant. If you're wearing underpants, if you're able to, that would help issues. But because I was wearing a hospital gown the whole time and I had so many scars, the appendix scars, a drain into one side of my stomach, a drain in the other side of my stomach, and other incision points, draining blood and fluid and gunge and whatnot into various bags dangling from my body, plus the catheter in my hands attached to that hat stand thing that you have to walk around with everywhere, which is hydrating you. Everything you do was very difficult to move, and getting underpants on over those scars was quite difficult, so I didn't do that until about the second or third day. But then things died down a bit in that department. So notice how I've spent so much time on my nether regions there, being a chap, much more time than anything else so far. Anyway, I better move on. Nurses, look, yes, the food wasn't great, but you expect that in hospitals, don't you? I was going to go on with a list of sort of mini gripes that I had, but I'm not going to do that because in hindsight, the nursing team are fantastic. Everybody's been fantastic so far for me. I'm blessed to have the country that I live in, the NHS, has swung into action for me, and I'm being fast-tracked to given most amazing service. I can't criticise people who save your life. How can you do that? How can I do that? The nurses work so hard. They've got so many patients to look after, and there's not enough of them, and they don't get paid enough. I don't want to be political about it, but they don't. It's a terrible job sometimes, and most of them are just so nice and want to help you. Anyway, enough on that. I want to mention particularly, I had a conversation with one nurse who turned out to be, she was an agency staff who in one of the few moments of downtime, she was able to explain that she was there actually filling in a slot, backfilling because they were short-staffed on the ward. But generally, she's doing a student nursing degree. She has to pay, since apparently 1998, nurses doing their degree have to pay their £9,000, whatever it is, to get that degree. And when you are being nursed in hospital by a student nurse, they are paying for the privilege of nursing you, doing their placements here. And yet so many people give them so much grief. It's terrible. There's one chap there who was he didn't want to be in the hospital. I think he was a bit senile. The amount of time the staff had to spend with him overnight, it was taking them away from other duties. They have to put up with so much, and they have my utmost respect, and they really deserve a lot more. I'm glad I clapped the NHS during COVID now, absolutely. Anyway, what else can I say? So yes, out I came yesterday, and I am now under the Enhanced Recovery Admission Team, ERAS. Yes, under Connie. Connie's in charge of this team, and she's a lovely lady, as is everybody. And Connie was explaining to me how this will work, and they're giving me the aftercare because they're basically an extension of my inpatient status. So, they are replacing the care that I would get on the wards. I've been discharged early, so they need to come and change my dressings and things for a little while just to make sure I'm okay, take my blood pressure and all, make sure everything's fine. I had my first visit today from Tracy and from Lime Rose, lovely people. They've changed my dressings, made me feel comfortable and given me that reassurance that they're there to support me. And it's so important because it's scary coming home, even when you've got a nurse like I have living in with me called Helen, who is fabulous, my wife. I'm so happy that I have you there for me. So thank you, Helen, for all you're doing. I'm welling up now. Stoma nurses. The Stoma okay, I've got the bag. I'm getting used to that. It's okay. It's much better than I thought it was going to be. It doesn't smell. That was my biggest fear. I thought that everyone around me would be going, why isn't that Stoma like, why didn't they put it down your knee or something, furthest away from your nose as possible? But no, it's not like that. The bags that you stick on are odourless. They don't smell, so don't worry about that side of it. In fact, it's actually quite a good way of getting rid of waste products from your body. You don't have to go and sit on the toilet and do what normal people do. You can just empty the contents into the toilet, and then you can wipe the bag, fold it back up again, and you've done it. And you change the bag once a day or something, and it's okay. It really is. At the moment, I've got this see-through thing, which isn't pleasant, but that's so staff can see the contents of it and see the colour and consistency, because it's very, very liquid. It's like gravy or something. And yesterday, Helen, we had a little bit of fish. I can only eat tiny portions. I haven't got much appetite. And that fish was very strong. It was a strong haddock, with the yellow sort of texture, colour that you get on that. And I think I had a bit of an adverse reaction to that, because the contents of the bag was it was not very pleasant and very bubbly, very gassy. Graphic, I know, but you've got to know these things, haven't you? One thing is the Stoma nurses said, lovely team, and I think they're going to contact me tomorrow, and they're going to come and visit me too, and they've given me all my products. They will keep those products coming to me. Isn't that amazing? They deliver them to my home. How good is that? One of the things they have a thing about is naming your Stoma. So I hadn't heard of this before. Name your Stoma. I didn't know what to name it. Helen, all credit to you. She's come up with the name Donald. Going to call it Donald. Why? Because it trumps all the time. Great name, eh? Donald trumps. Yeah, and also it quacks as well. So it's a dual sort of name. Maybe things will settle down a bit, because it is a bit noisy at the moment. I hope it is, because I don't think I could go out in public again. Right, what else happened? Just I'm going to finish off soon, because God, I'm up to 12 minutes already, way the longest. Right, tips for packing for hospital. I took in way too much. I had a great big holdall packed full of clothes, and I also had another rucksack full of like useful things like books and headphones and things to keep me occupied. No, I didn't need that. I wore the hospital gown the whole time. You don't want to put your clothes over the guns that comes out of your body, do you? Because things could be replaced, and you get your own clothes dirty, they're just going to be washed. Wear a hospital gown, they're just as easy. And also pillows. I took in 2 pillows, because the pillows aren't particularly soft and comfortable on the beds. And yeah, I think that was quite a good thing to do, and they're light and easy to carry out. Carrying out, I would say, when I was discharged yesterday, I was a bit worried about carrying the weight of all these things away, because I've got to be very, very careful not to do any heavy lifting. I have to breathe. I keep forgetting to do it, but a deep breath, a blow out. Connie, if you're watching this, see, deep breaths every time I remember to do it, because that's going to help with the recovery. And every time I feel a cough or a sneeze coming, I'm scared stiff. You have to hold your stomach in and be very careful doing that. Obviously, I don't want to burst anything. What was I getting to? Yes, the discharge team. So when they when they released me off the ward yesterday to come home about 3 o'clock, I was worried how I was going to get my heavy stuff away. They said, don't worry, someone will come and take you in a wheelchair. Great, I said. So the wheelchair arrived with this person who took one look at my bags and said, I'm taking the bags, you're walking. Oh, thanks for that. It was a long walk, and they were ploughing on ahead. I had to keep up. It was hard to keep up, and I think that tired me out a bit for when I came home, and I think that did actually cause me a little bit of unnecessary sort of strain yesterday. But as a general rule, Princess Royal Hospital, thank you so much for everything. Thank you for saving my life, especially you with the big hands, Mr. Kostadinov. Thank you, sir. Right, okay, that's all I'm going to say, except just to say when I got home there was a few cards, and I'm going to go to a separate little bit now just to show you that. Okay, I think we're back. So thank you for all the cards. And look, what do I have to eat? Let's look at that. Good. Now look at all this lovely food. Well, it's not healthy, but this is what I've got to eat. It's low-fat diet, you see. Completely opposite of what I normally have. Somebody's got all this in for me. Who could that be? Oh, look, it's my special nurse carer. There she is, Helen. Oh, she's so wonderful. I'm so lucky to have her. Thank you, my love. And look, this card. I know it's back to front probably, but what is this? Look, open it up, please. I'm so sorry, but we just cannot make out who that's from. Whoever it is, thank you so much, but I just want to thank everybody. Yeah, so whoever you are, thank you for that card. And thanks to everybody for your support. Thank you for all the lovely messages again on YouTube. I have responded to all of them, I think, in a way. And I know you say don't reply, but I just can't help it. If you take time to respond to me, to send me a message, I feel I just have to say at least thank you back. Anyway, I'll keep you informed. Any questions, please ask. That's what I'm here for. And to my friend, Nell, I think it is, Quimmo, you sir are suffering wherever you live. You need more help, mate. You need to get your stomach sorted out. And I say I'm blessed I live in the UK. I do hope, I think about you quite a lot because I know you're not getting the help that you need. In the messages, the last exchange we had, that was obvious. Anyway, best of luck to you and best of luck to everyone else, and keep checking your poo, everyone. Bye for now.